Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. We're going to continue to emphasize the importance of those key activities people can do. We are seeing that it works. Wearing a cloth face covering, maintaining the 6 feet of distance, that's what works to help control the spread of COVID. I also want to thank everyone at the Rhode Island National Guard, everyone in the testing work stream of the state's COVID-19 response, and everyone at CVS who helped make the testing site at Twin River such a success. We were able to identify more than 4,000 positive cases at the Twin River site, which meant that we were able to get these people into isolation very quickly and able to get to their contacts and get them quarantining very quickly. Also, key elements to us controlling COVID. Having said that, the shift we are making is a good one. Over the last several weeks, we've worked very hard to locate testing sites in the community. We want testing to be as accessible as possible to people in the hardest hit communities, and we want testing to be just as accessible for people with transportation challenges as well. As a reminder, if you have symptoms, but you either have not been tested yet or are waiting for your results, first, get tested, and second, even if you received a negative result, you should still isolate at home as though you have had COVID-19 until your symptoms are completely resolved. That's critical, particularly as we're coming up into flu season. We want everyone to understand if you have any symptoms, once you've gotten tested, you should be staying home to recover completely. In terms of our data for today, we're continuing to see relatively low numbers at this point. We have 73 new cases to report today. There are 104 people currently hospitalized. Of these 104 people, 20 people are in the intensive care unit in hospitals across the state, and 16 people are on a ventilator in one of those ICUs. Sadly, we have 6 new COVID-19 associated fatalities to report for today. One of these people was in their 70s. One of them was in their 80s. Another one was in their 80s. One was in their 90s, and 2 were older than 100 years old. Our prayers continue to be with the families of these treasured Rhode Islanders who have passed away. I also want to update on our thinking for nursing homes and assisted living facilities. We have shared recently that during phase 2, the challenging decision to have no visitation to nursing homes and assisted living facilities must continue. We have also been using this time during phase 2 to prepare for the approach that we want to explore for phase 3. The approach we're taking at these facilities is similar to what's happening throughout the state in that we are taking a measured, gradual approach. We're not going from no interaction in nursing homes to just full visitation overnight. That would be dangerous, and our plan is to move safely, steadily, and incrementally. So I just want to take a few minutes to share what our approach has been as we prepare during phase 2. Last week, we sent guidance to nursing homes and assisted living facilities, allowing them to restart communal dining and activities for residents within the nursing home facility. To be clear, that is just for the residents in the facilities. The assisted living facilities started resuming those communal activities on Mondays, and nursing homes started today. It's a way to start very limited and to assess what slightly increased mobility within the facility would look like. What we said to facilities is that we want you to be able to do this safely and effectively for 14 days first. In the meantime, we're continuing to collect and review plans from facilities on an ongoing basis for how they would allow visitation in a way that is safe for everyone. We've received roughly 40 plans from facilities thus far, and we'll continue to engage with them to make sure that each facility has the bare minimum approach and understanding to how to address visitation in a steady, phased, slow start. What we are working on with facilities is to slowly gain the experience with a slight increase in mobility while making sure that we are keeping patients and staff safe. We recognize that this has been an enormously trying time for residents and their families. And we want to make sure that you can hear what our general vision is when it comes to our approach to visitation, making sure that it's slow and steady and safe. As we've been saying, whenever we have talked about how we will go forward in the future, everything also continues to depend on data and disease trends, which we will continue to monitor extremely closely. I'll finish with making two other points when it comes to visitations and expectations. The health and well-being of residents and staff are absolute priorities for the administrators of facilities in Rhode Island, for the staff of those facilities, and for the families of the residents. We understand that. We all have the same goal. That being said, there may be an instance in the future in which an individual facility, in consultation with the Rhode Island Department of Health, makes decisions about visitation that are a little more restrictive based on the data that they have. All facilities are different, and what I've described today is only a general approach. We will continue to work closely with facilities, the staff, the administrators, and the families to support them so that you can be ensured that this process will continue to be safe for your family members. The second point that I want to make is that when visiting does happen again, it is going to be different. You're going to be wearing your mask. You're going to be practicing social distancing, staying 6 feet apart. There may be visitation outside because the transmission of the virus is less when it's outdoors. And you're probably going to be making appointments and doing other things that you may not have been accustomed to previously. So as we're all preparing for this decision, when that time is right, we want to make sure that you also have the tools that you need. Have your cloth face covering and have the preparation for distancing. So we ask you to please be patient with administrators and staff at facilities. The aim of everything they are doing and we are doing is keeping your loved ones safe.